Multiple chronic conditions are when a person has 2 or more ongoing chronic conditions lasting a year or longer. And some examples are diabetes, depression, cardiovascular disease, and sometimes even cancer. Abt Associates recently updated statistics on multiple chronic conditions, and about 1/3 of all Americans of all ages have MCC, and in the over 65 population, that goes up to 80%. So it's a big problem and is only going to become increasingly important as the population ages. Almost half of all individuals living with chronic conditions have activity limitations, like trouble getting dressed, grocery shopping, bathing. So living with multiple chronic conditions has a big impact on quality of life. It also has a financial impact in terms of out-of-pocket healthcare expenditures, multiple medications, and multiple medical appointments. There's not only an impact on the individual, but also their caregivers and their family members. Abt Associates is doing a lot of work on multiple chronic conditions in collaboration with the Department of Health and Human Services. Recently, we looked at federal data sets that can be used to study people with multiple chronic conditions and also to explore disparities in the population with MCC. We're also researching ways that healthcare training materials can be adapted to better help providers learn how to care for patients with these complex needs. We've also done a lot of work translating research on multiple chronic conditions into information that is understandable and actionable for policymakers, clinicians, and the lay public. For example, we recently developed a video on what it's like to live with multiple chronic conditions. The video is called Multiple Chronic Conditions: A Day in the Life, and it follows a woman from the start of her day through appointments with multiple providers where she receives instructions, prescriptions, treatments, and how she is trying to manage all of this and at the same time live a balanced life with her family and friends and work.
But what if there were just one care plan, created just for May and with May? One plan that would treat her as a whole person, rather than focusing on each of her separate conditions. A plan that's created by her care team, with May and her family, that's easy to understand and is agreed upon by everyone. Like everyone, patients with multiple chronic conditions deserve a better healthcare system, one with less confusion.
Multiple chronic conditions is a serious public health issue, and we believe that our work is contributing to progress in both multiple chronic conditions care and research.